Why choose subtotal hysterectomy for cervical cancer? When considering treatment options for cervical cancer, many patients may wonder about subtotal hysterectomy. This procedure, also known as supracervical hysterectomy, involves removing the uterus while leaving the cervix intact. It can be an option for certain cases of cervical cancer or other gynecological conditions, and it comes with both advantages and important considerations. One of the main benefits of subtotal hysterectomy is that it is less extensive than a total hysterectomy, which removes both the uterus and the cervix. This means that the surgery can be quicker, with shorter operative times and less perioperative bleeding. Because it is generally considered an easier procedure, there may also be fewer immediate surgical risks, such as injuries to the urinary tract or nerve damage in the cervix area. Additionally, by retaining the cervix, some women may experience better pelvic floor support and maintain sexual function, as the cervix has nerve connections that play a role in sexual arousal and orgasm. However, it is crucial to understand that subtotal hysterectomy does not eliminate the risk of cervical cancer. The cervical stump that remains can still develop malignancies, including a rare form known as cervical stump cancer. This means that ongoing cervical cancer screening is essential after the procedure to catch any abnormal changes early. Research indicates that cervical stump cancers may be diagnosed at a more advanced stage, and the treatment for these cancers is similar to that for cervical cancer with an intact uterus. From a cancer treatment perspective, subtotal hysterectomy might be chosen in specific cases where a less radical approach is appropriate, or when preserving the cervix is important for functional reasons. However, it is not typically the standard treatment for invasive cervical cancer, as the total hysterectomy is preferred to remove all at risk tissue and minimize the chance of recurrence. In summary, subtotal hysterectomy may be an option for some patients when weighing the risks of surgery, the time it takes to operate, and the desire to preserve certain functions. However, it is vital for patients to receive thorough counseling about the ongoing risk of cervical cancer in the retained cervix and the necessity for continued screening. Each decision should be personalized, taking into account the stage of cancer, patient preferences, and overall health. Total hysterectomy is often the more definitive choice to eliminate the risk of cervical cancer entirely by removing the cervix. Always consult with a healthcare professional to discuss the best treatment options for your individual situation.